LoveLife South Africa is expected to launch a mobile clinic in Diepsloot in Johannesburg. The initiative is aimed at combating gender-based violence and femicide in South Africa in partnership and to give support to those victims. South Africa has one of the highest rates of intimate partner violence, or IPV, in the world, with approximately 51% of women experiencing IPV at least once in their lifetime. To take this discussion further, let's welcome Mr. Thilivhali Livhadi, LoveLife Gauteng Provincial Programs and Operations Manager. Thilivhali, a very good afternoon to you. Thank you so much for joining us. So tell us more. I mean, what prompted this decision for LoveLife to go through for this initiative?
Good afternoon to you and good afternoon to our viewers. We are implementing our programs every day in communities, and we found out that we have a number of issues, as per the statistics that you've indicated, of high number of intimate partner violence, gender-based violence, and femicide in our communities. And we realize that as LoveLife alone, we cannot be able to solve all these problems. And luckily, we got a partnership from Sasol, who then partnered with us to have this mobile clinic unit, so that we are able to extend our services closer to communities that are far-flanked from areas where they can access these services. So we are now going to be able to access those communities to avoid them traveling long distances, because even those distances increase the fatigue and they end up not going to get help. So we'll be able to reach them out to where they are, so that we render services to them.
Now, Thilivhali, this one will particularly be in Diepsloot. Are you planning on, of course, extending to other areas in the country, particularly in some of the areas where mobile clinics and the type of assistance that you've actually mentioned will be, of course, granted by this clinic cannot be easily accessible to those residents in far-flung areas and townships?
Yes, exactly. We are just launching it in Diepsloot, and following that, we would be able to raise awareness around Diepsloot area. Mm-hmm. But we are moving to other areas like Mamelodi East, Tembisa, Alexander, Soweto, Honeydew. And in the following month, I think we'll be launching it in KZN. So we will be moving from one area to another to reach out to our communities.
That's a great initiative. Then tell us more about the type of services that this mobile clinic will actually cater to the community.
Yeah, we're going to render our groundbreaker services, where our groundbreaker will be implementing health talks to all those who will be accessing the mobile unit. And from there, they will then have counseling services from our trained professional counselors in the unit. And then they will also have an opportunity to be assisted by the unit nurse. So these are the services that will be offered, and also to refer them to other services that would need more intense or more concentration than what we can offer in the unit.
Now, LoveLife is known as a youth-focused HIV prevention initiative in South Africa. However, youth infections, according to the latest stats, Thilivhali, have been on the rise throughout the years. What has been your observation, and how are you actually engaging with young people in this matter?
Yes, you see, we have been trying to celebrate at some times around 2016 to 2018 about the rate of new infection of HIV and AIDS and teenage pregnancy. But we realized that we've been focusing our campaigns particularly to young people and avoiding adults, males especially, who then we realized after 2018 that they are the ones who are influencing the new rate of infection and teenage pregnancy because of poverty. Because our young girls are then influenced by peer pressure, by those who have the materials to have, and then these men then exploit this young girl through those issues, and then we then have the numbers rising again. So we are now directing our programs also to men and in the society in general.
Now, you spoke earlier on about having multiple collaborations for this particular initiative. Can you tell us more about those, and what type of more assistance or other assistance are you still looking for, Thilivhali?
Yeah, working alone, we can't do much. So we are partnering with the ANOVA Health. They will be part of these programs when we move on. We are partnering with Safer South Africa Foundation. They will be part of this initiative because there's element of safety and domestic violence in itself. We want people to be exposed into the systems of our criminal justice system in the country, how it works. So Safer South Africa will come with that expertise. We are joined by the obvious and always our partner Department of Health at national and provincial level, and also we are joined by Soul City as well. So they will be part of the process and assisting us in extending these programs to the communities.
Talk to us about your operating hours, the type of actual assistance that you will be able to afford those that seek help or assistance from your facilities.
Yeah, the mobile unit will be working from 8 o'clock in the morning up until 4:30 in the afternoon. And they can also access us through the use of our psychosocial contact center by just sending us a please call me number. And then our trained counselors will then call them back at 083-323-1023. And they can also follow us on our social media platform by just DMing us, and then we'll be able to respond. But the unit would be in those communities from Monday to Friday, 8 o'clock until 4:30.
Thank you so much for that. That number again, 083-323-1023. That is Thilivhali Livhadi, LoveLife Provincial Manager.